Welcome back, everybody. We're diving into the future of healthcare today, specifically the year 2025.
Wow, 2025,
Yeah,
that's closer than it seems.
it really is. And we're looking at an article here called Game-Changing Tech in Healthcare, the 2025 Revolution.
Oh, very catchy title.
It is catchy, right? And it's really fascinating stuff. They're predicting personalized treatments, unbreakable data security,
Mhm.
even doctors using virtual reality like right in the operating room.
Yeah, the article isn't just talking about like one single breakthrough. It's really about all these different technologies sort of converging
Yeah,
at the same time.
right.
And they're all kind of working together to reshape the entire healthcare experience, which is pretty amazing when you think about it.
Yeah, and they start off talking about something that I think is on everyone's mind these days, data security. I mean,
Oh.
especially after those massive data breaches we saw back in 2023.
Yeah.
41 million healthcare records compromised. It's scary stuff.
Absolutely scary stuff. But that's actually where this article starts to get really interesting and talks about how blockchain technology could make those kinds of breaches a thing of the past.
Okay, so blockchain is basically a digital chain of data blocks, each block linked to the one before it in a way that's virtually tamper-proof.
Exactly. And the article even mentions how blockchain in healthcare is projected to be a multi-billion-dollar market by 2025. It's growing at an incredible rate.
Wow. So it's not just a buzzword then. It sounds like it's actually being implemented and making a difference.
Oh, yeah, absolutely. It's already happening. The article highlights three key areas where it's really making waves. First, it's transforming how medical records are stored and accessed.
Okay.
So imagine a system where your health information is completely secure and you have full control over who can see it. That's the power of blockchain.
So no more worrying about your sensitive medical information falling into the wrong hands.
Right. And second blockchain is streamlining insurance claims using something called smart contracts.
Smart.
Yeah, they're basically self-executing contracts stored on the blockchain.
I'm trying to picture how that would actually work.
So instead of mountains of paperwork and endless phone calls, you can have your insurance claim processed automatically, like almost instantly.
Wow, that would be incredible. No more fighting with insurance companies.
Exactly. And the third way blockchain is revolutionizing healthcare is by helping to combat counterfeit medicines.
Okay, that's a huge problem.
Oh, absolutely. It's a global issue. But by tracking each medication on the blockchain from the factory all the way to the pharmacy, we can help ensure patients are getting the real deal.
So it's saving the industry money and, more importantly, saving lives.
Exactly. And that's just blockchain. The article also dives into the role of artificial intelligence, and it's not just about robots performing surgery, although that's happening too.
Yeah, I was going to say.
The article really emphasizes how AI is moving beyond the theoretical and into practical applications that are already improving patient care.
So it's not just a futuristic fantasy. It's happening now.
Right now, think about AI algorithms analyzing tons of data to detect the earliest signs of disease, like way before a human doctor could even notice it.
It's like having an AI detective constantly monitoring your health for any red flags.
Yeah, that's a great way to put it. And that early detection could be life-saving.
Absolutely. And the article talks about how AI is also being used to personalize treatment plans.
Oh, yeah. Personalized medicine is huge right now, but AI takes it to a whole new level.
How so?
We can create custom treatment plans tailored to each patient's unique genetic makeup lifestyle factors. All sorts of data.
So no more one-size-fits-all medicine.
Exactly. Treatment that's specifically designed for you, maximizing effectiveness and minimizing side effects.
No, that's the future I want to be a part of. And what about AI and diagnosis?
Oh, that's another area where AI is really shining. Imagine AI analyzing medical images lab results all the data a doctor would look at,
Yeah.
but with incredible speed and accuracy.
So it's like having a team of specialists analyzing your case?
Exactly, ensuring that nothing gets overlooked and that you get the right diagnosis early on, which is obviously critical for effective treatment.
Absolutely.
So yeah, AI is already having a massive impact, and it's only going to get bigger.
It's exciting and a little bit intimidating all at the same time.
I know what you mean, but the potential for good is enormous if we use these technologies wisely.
Definitely. And this is just the tip of the iceberg. The article goes on to talk about virtual and augmented reality as well.
Yeah, that's where things get really futuristic.
I can't wait to dive into that.
Me neither. Let's take a quick break, and then we'll jump right in. Okay, so we're back and ready to dive into the world of virtual and augmented reality in healthcare.
Yeah, this part of the article really blew my mind. It sounds like something straight out of a sci-fi movie.
I know, right? But it's all becoming a reality.
Yeah.
Remember those scenes in movies where doctors use holograms and stuff?
Oh, yeah.
Well, that's what we're talking about. VR and AR are revolutionizing everything from medical training to patient care.
So let's start with medical training. How is VR changing the game there?
Well, think about it for a second. Imagine medical students being able to practice complex procedures in realistic virtual environments.
Hmm.
They can hone their skills, make mistakes, and learn from them all without any risk to actual
So
patients.
it's like a flight simulator, but for surgeons.
Exactly. And the article highlights how effective this kind of training can be, especially for procedures that require a high level of precision.
It makes sense you don't want a surgeon learning on the job when it comes to something as complex as brain surgery.
Right. And the article also talks about how experienced surgeons are using VR for preoperative planning.
Okay, so they can basically walk through the entire surgery in a virtual world before they even step foot in the operating room.
Yeah, they can visualize the procedure in 3D, identify potential challenges, and refine their approach all in a safe virtual space.
That's incredible. It must really improve their confidence and precision going into the actual surgery.
Absolutely, and that translates to better outcomes for patients.
So we've talked about VR, but what about augmented reality or AR? How is that different?
Well, VR creates a completely immersive virtual world, while AR overlays digital information onto the real world.
Okay, so it's like adding a digital layer to what you're already seeing.
Exactly. Imagine a surgeon wearing an AR headset during surgery.
Hmm.
They could see critical anatomical structures highlighted right in their field of vision.
Wow, it's like having X-ray vision, but even more detailed and precise.
Exactly. And it allows for greater accuracy and minimizes invasiveness.
So AR can make surgery safer and more efficient.
Absolutely. And the article also talks about how VR and AR are impacting telemedicine.
Oh yeah, telemedicine has become so important, especially in recent years, but I can see how VR and AR could take it to a whole new level.
Right, imagine a doctor being able to guide a patient through physical therapy exercises in real time, even if they're miles apart.
That's amazing, especially for people in rural areas or those who have difficulty traveling.
And it's not just limited to physical therapy. The article also mentions VR and AR being used for things like diagnosis and treatment planning.
Okay, so how does that work?
Well, doctors can use AR to manipulate 3D models of organs or fractures.
So they can get a much better understanding of what's going on inside the body.
Exactly. It gives them a whole new perspective and helps them come up with more effective treatment strategies.
So VR and AR are clearly transforming the way healthcare is delivered, but the article also mentions AI agents, and this is the one I'm a little unsure about. Are we talking about robots taking over the healthcare system?
Well, the article takes a more nuanced approach. It's not about replacing human interaction entirely, but rather augmenting it and making the system more efficient.
So it's about finding the right balance between human expertise and AI capabilities.
Right, and the article suggests that AI agents could handle a lot of the routine tasks in healthcare, like scheduling appointments, answering basic questions, even triaging patient calls.
That makes sense. It would free up doctors and nurses to focus on the more complex and human-centered aspects of care.
Exactly. And it could also improve the patient experience. Imagine being able to get your questions answered or schedule an appointment at any time without having to wait on hold.
That would be a huge improvement. I can see how AI agents could make healthcare more accessible and convenient for everyone.
And it goes even further. The article talks about specialized AI agents, each one an expert in a specific area of healthcare working together as a network.
So instead of having one general AI agent, you could have a whole team of AI specialists.
Exactly. They could analyze patient data, identify potential risks, and suggest personalized treatment options to doctors.
It sounds like it could significantly improve the quality of care.
Absolutely, and that's ultimately what it's all about.
But what about the impact on healthcare jobs? I mean, are we going to see widespread job displacement because of AI agents?
The article acknowledges that there will be shifts in the workforce, but the focus is on augmentation, not replacement.
Okay, so it's not about robots taking over jobs. It's about robots helping humans do their jobs better.
Right? AI agents could take on those more routine tasks, which would allow doctors and nurses to focus on what they do best, building relationships with patients, providing emotional support, making those complex medical decisions.
So it's about using technology to enhance human capabilities, not replace them.
Exactly. And the article emphasizes that this could lead to a better healthcare experience for everyone involved, both patients and providers.
It's definitely a lot to think about, but it's also incredibly exciting to see how technology is transforming healthcare in such positive ways.
Absolutely. And the article ends by quoting a healthcare expert who sums it up perfectly.
Okay, let's hear it.
Technology should make healthcare better, not more complicated. The future is about making your healthcare experience smoother, safer, and smarter.
I love that quote. Really gets to the heart of what we've been talking about.
It's not about technology for technology's sake. It's about using technology to improve people's lives.
And make healthcare more human-centered, not less. You know, what really strikes me is that it's not enough to just have these amazing technologies we have to use them in the right way.
Absolutely. The article really emphasizes that technology should be a tool for empowerment, not a source of confusion or alienation. It's about making healthcare more human-centered, not less.
Yeah, and I think this deep dive has really opened my eyes to the possibilities, and honestly, it's a little overwhelming. There's so much happening in healthcare innovation.
It really is. And this is just the tip of the iceberg. I mean, the pace of change is only accelerating. So as we move further into 2025 and beyond, who knows what incredible breakthroughs we'll see.
Yeah, it's exciting and also a bit daunting. We need to make sure we're asking the right questions about how these technologies will be implemented, how they'll impact patient privacy and autonomy, all those things.
Oh, absolutely. We can't just blindly embrace new technologies without thinking critically about the potential downsides.
Right. It's about shaping the future of healthcare in a way that aligns with our values and priorities. So for all of you listening out there, here's something to ponder as we move towards this future with AI agents managing so much of our healthcare experience, from appointments to insurance claims. Are we risking losing the human touch in medicine? Or could these AI agents actually free up doctors and nurses to provide even better, more compassionate care?
That's a really thought-provoking question, and honestly, there's no easy answer.
Yeah, it's something we all need to be thinking about and discussing as these technologies become more integrated into our lives.
Definitely, we need to have those conversations now so we can shape the future of healthcare in a way that benefits everyone.
Well, this has been a fascinating deep dive into the future of healthcare. Thanks for joining us.
It's been a pleasure.
And for everyone listening out there, keep those questions coming, stay curious, and let's all work together to create a healthcare system that truly serves everyone.
Well said.